MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Good evening. Welcome to your Direct Connection. Tonight we connect you with an investigation into why the centerpiece of downtown Baltimore, Harborplace, is struggling to survive. The retail and restaurant complex opened nearly 40 years ago. It was the capstone to the revitalization of the inner harbor. Now the buildings are half empty and city leaders are looking for a way forward. Joining us is Melody Simmons of the Baltimore Business Journal. Melody, thanks for being with us.
Thank you for having me.
You reported this big cover story on the Business Journal. You were working on it for 6 months. What were you most focused on?
This was a legacy story. As we know in Baltimore, we've just seen this centerpiece of our city, us old-timers. We saw it planned, we saw it open, we saw just the great reception that Harborplace had back in the 80s. It really put Baltimore on the map, and it added to the downtown renaissance that began with Charles Center. So reporting this story in 2019, looking back, you just have a lot. It's been a bumpy road the past, I don't know, maybe decade or so.
We're all sort of fond of the place, I think. But if you walk through it these days, you see, empty storefront next to a for lease sign. Mm-hmm. What are the numbers like? How empty is it? Because from the outside, it sort of looks okay.
Well, inside, as you said, when you walk in, you're going to be very much surprised at how vacant it is. It's likely, the way we see from the reports, it's at least 60% vacant, possibly 70. There are anchor stores, anchor restaurants that are still there, and those are the larger spaces that are leased. But the smaller stores that really gave Harborplace its its vibrancy, and it really tied it to Baltimore because they were a lot of local businesses. They're all gone.
What's the legal status of the place? Everybody thinks maybe it's owned by the city, but it's privately owned.
That's right. It's a strange situation that it's a private development, but it's built on public land. So the legal situation right now is the ownership of it has been taken away from Ashkenazi Acquisition Corp. They're based in New York. They own a lot of high-profile developments, including Union Station in D.C. They have a stake in the Plaza Hotel, Bayside in Miami. They have a lot of high-profile developments, but they let Harborplace kind of slide. And because of that, the whole development went into receivership May 30th. And that's because the loan went into default in March.
There's a big loan. I mean, somebody's owed a lot of money on a place that's half empty.
That's right. And we found, looking into this story, I found that I was very interested to see that they had appealed to the state last year and gotten the assessment of the 2 pavilions reduced by the state. So the property value has now been stripped down by 1/3.
Let me remind our viewers, if you have a question about Harborplace, if you have an idea to fix Harborplace, give us a call. We'll have the number up on the screen. You can also email a question. The email address is livequestions@mpt.org. Part of your reporting, you talk to a lot of tenants.
Yes.
What do they want to happen?
The tenants are happy to be there, but they're lonely. Basically, I have to tell you, they don't have a lot of feet on the street, and they really have issues trying to get their businesses running. So they're very upset. We did speak with a lot who said that they've asked for rent reductions through the receivership. They're not in negotiations now to get that, but they're saying that they may have to close their doors as well because they can't afford to stay open.
Let's take a phone call from Anne Arundel County. This is Carol. Carol, thank you for calling. Go ahead.
In the early 90s, late 80s, early 90s, I booked conventions in Baltimore City. Mm-hmm. In one case, we had a lady who got into the back of a cab and was actually stuck by a needle that had been left in it. That's one situation. Now, 30 years later, we've got enough violence down there to scare everybody off.
Carol, thank you so much for the phone call. And certainly public safety is a factor citywide.
That's right. We wrote this in the piece. We actually went back and looked at 2015. We looked at some data that the city had dealt with after the unrest following the death of Freddie Gray. And that had an impact on the whole city, and including Harborplace. Who can forget? The National Guard was posted outside of Harborplace. We have a photo in a timeline in the story package. And it shows that, it's seared in a lot of people's minds. There is issues. People are concerned about public safety, and they're concerned about where would they park, how would they get there. So there's a lot of questions right now surrounding it.
Email question from a viewer. It's obviously prime property. Is someone just sitting on this for a big windfall?
No. They're not. I mean, you'd think they would be, but because it is prime property. And as Baltimore goes, it's really the heartbeat of the city. It is a beautiful waterfront area. Everybody who's been down there and walked that promenade on a beautiful spring or summer day knows that it's so enchanting and you love it. So right now, it's just in trouble. And it's struggling. And basically, it's in the courts, trying to work its way through the courts.
We have some big-name real estate developers in this town. Of course, this was a Rouse property originally,
Yes.
which was the biggest of the big names. Have you talked to Gibbons, Cordish?
I've talked to both.
What do the big thinkers think could be done?
Well, the big thinkers are very this is still a beloved project for them. They're local. They think it should go back to being locally owned. They want to help as much as they can to get it back in local hands, because these local developers know what Harborplace can and does mean to the city and how it could lift the city at this point in time.
So the problems here are, there's the overall safety thing in Baltimore, which hopefully gets fixed, ceases to be a problem at some point. Mm-hmm. There's the building itself, which is kind of the wrong building for this century. It was kind of built as a mall of a generation ago. Mm-hmm. And there's the fact that some lenders are owed $70 million.
A lot of money. We don't know how the dig out is going to take place. We do know that these buildings are old, as you said. They are utilitarian. They were designed that way. They really don't have any kind of storage in them. So what you see is what you get with these pavilions. So any businesses that go in, any restaurants, they have to be able to make do with their space. So this is very different in this day and age.
Couldn't have one gigantic tenant like, the Light Street Pavilion just becomes a Walmart or something.
Well, who knows? We might have a food hub. We may have a craft brewery.
Phone call from Anne Arundel. This is Chuck. Chuck, thanks for the call. Go ahead.
Hi, thanks for taking my call.
You bet.
My question is it really relevant to have the Harborplace anymore? Since it was put in there was nothing to speak of in the area. But now there's so much to do around the area that people aren't attracted to that Harborplace anymore, but they're attracted to the peripheries, from the power zone over to the convention center.
Yeah. Chuck, that's a great point. Appreciate the phone call. There didn't used to be all this retail lining Pratt Street.
We talked about that, you and I think in some ways what we found reporting this story was that Harborplace may well be a victim of its own success. And that means that it really started something. It brought people down to the harbor, and because of that, you saw a great growth move east. We now have Harbor East, Harbor Point, Fells Point's all gussied up, and Canton around the way. So all of these places really came to life as a result of Harborplace. Do we still need it? Some say yes.
Yeah, the city encouraged, subsidized a lot of those new developments, which has sort of hollowed out the central business district, the old Charles Center, and the harbor.
Yes, as covering development in the city, I can tell you that there always seems to be some kind of a, leapfrog game going on with communities downtown, with the district, with businesses. A lot of times offices will move out of one building and into another and leave a hole here and fill a hole there. We've been writing about this for years. It's a pattern.
Here's a good email question. Instead of stores, which are all in decline, The focus should be on live experiences. I would suggest entertainment ideas where you have to be there in person, and he lists a number of things including bowling alleys. I like that one, a big duck pin alley right on the harbor.
Wouldn't that be fun? It's so vacant right now, you could put a bowling alley in. I'll tell you, I went to the Light Street Pavilion, and my thought was you could put a bowling ball down here and it wouldn't hit a soul.
Let's take a call from Baltimore City. This is Lisa. Lisa, thank you for the call. Go ahead.
Yes, actually, you just asked a little bit about my question.
You had the bowling alley?
No, I have the BQ Pavilion that I have a question about because that is a live entertainment center, which I enjoy. I'm wondering if that is something that will be permanent. I've heard that they're renting space, and I wonder if when that contract is up, could it be sold for a high-rise condominium, or will it always be an entertainment section?
Interesting question. Thank you very much.
Lisa, I tell you, you're thinking like a developer now. I will say, backing it up, Harborplace was born on a city charter amendment. So that amendment has some rules attached to it, and the rules limit the height. So you can never have a high rise there. In fact, you can't build above the top of the mast of the USS Constellation. So,
did not know that.
Yes.
It was like Billy Penn's hat in Philadelphia,
Exactly.
but they built past that one. Phone call from the city. This is Virginia. Virginia, thank you for calling. Go ahead.
Yes. I used to go down, take my grandkids down to the harbor back in the 80s. Very nice, inexpensive. But now it seems like it's all about the money. And people I wouldn't go down there now. It's too expensive, too dangerous. Put something down there that's going to draw people instead of putting big buildings around. Traffic, you can't find no place to park. It's ridiculous.
Virginia,
thanks.
thanks.
Doing anything about it.
Yeah, sorry to hear all that, but thanks very much for the phone call. I mean, those are the challenges.
These are challenges. I will say, Virginia, I spent a lot of time at Harborplace reporting this story. It still is as beautiful today as it was then. And, I urge you to just come back down on a very nice day and spend some time on the promenade.
That's true. I mean, this is a dreary time of year.
Yes.
We'll go. Sometime in the spring, we'll meet up there. We'll do the story again.
That's a deal. We'll get a
on
lobster
nice sunny
roll.
day.
Mm-hmm.
Call from Howard County. This is Jenny. Jenny, thank you for calling. Go ahead.
Hi. Yeah, I was just wondering, does the flooding impact the Inner Harbor, and is there anything that any plan to try to address the flooding?
Jenny, great question. Where the water taxi pulls up next to the Constellation, if there's a lot of water blown into the bay, that'll flood.
That's right, and it does flood. In fact, I believe it was last month we had a confluence of events. We had a full moon, we had a storm off the coast, and boom, we had big flooding. It doesn't happen very often, but it is a concern. And in fact, in reporting, we found in some email exchanges between the Baltimore Development Corporation and Ashkenazi that they put together a memorandum of understanding about flooding. And it took over a year to negotiate because it had to be fine-tuned. And this was to protect the Light Street Pavilion. So these things are on the radar screen of the city. As you know, there is, they might have to build up to preserve it. They're doing it in Annapolis now, at the Annapolis dock.
And we shouldn't leave this as an obituary for Harborplace.
No,
it's still
not at
open. There's business happening.
There's great
and in
business.
fact, there's the Christmas Village.
That's right.
Which is right in between Harborplace and the Science Center, which is thriving. Great place to get some local gifts before the holiday.
That's right. And another thing I'll say is this is still a happy place for the city. I think in reporting this story, a lot of people have great memories. It is beloved. So.
Very good. We'll leave it there. Melody Simmons with the Baltimore Business Journal. Thanks for your time.
Jeff. Thank you.
Appreciate it. When we come back, our health segment with more of your calls right after this.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
Are you turning 70 and a half this year? If so, you generally have to start spending down your retirement account. Even the minimum distribution can place you in a sticky situation. Luckily, you can now use your IRA to make tax-free gifts. Gifts up to $100,000 will never count as income, but always make a difference. That's icing on the cake.
Make your gift for this year before December 31st. Visit mpt.org/support.
This is a box that showed you a world beyond your own. It was just a box, but the world has changed, and so have we. And now the box can be almost any size or shape. And you decide what you want to explore. Anytime, any place. Break out of the box with PBS.
Joining us for Your Health tonight is Sarah Smallsley, Assistant Professor of Medicine in the Division of Infectious Disease at the Institute of Human Virology at the University of Maryland School of Medicine. Doctor, thanks for being with us.
Thank you for having me.
Your work focuses on HIV and AIDS. Where are we at the moment in terms of the spread of the disease and your ability to treat it?
Well, HIV is a very different disease than it was back in the 80s when it first started. We now have very effective treatments for it, and so if people are able to actually get tested and know that they're infected, there are multiple different simple to take one pill once a day regimens that can effectively treat HIV, and if people are treated well, we actually prevent it from spreading to their partners.
State of Maryland, City of Baltimore, our numbers are relatively bad. We're high on the list of places where this is prevalent.
That's correct. So Maryland is the #2 state in the whole country for HIV infection. Baltimore City ranks #4 among cities. But we do have some good news. Since 2010, the rate of new infections has actually decreased by about half because of the city's very aggressive and strong prevention and treatment efforts.
Still a lot of confusion, maybe among people you talk to, about the difference between AIDS and HIV. How do you explain it?
Sure. So HIV is a virus. It stands for human immunodeficiency virus. So that means that humans get it, and it's a virus that actually damages your immune system. People with HIV can develop AIDS, but they're not the same thing. So AIDS stands for something different. That's acquired immune deficiency syndrome. And that can happen essentially if someone with HIV doesn't get treatment and the HIV progresses to the point that their immune system is weak and can't fight infections and cancers very well.
Does it always progress?
No. So no one should get AIDS anymore. It's totally preventable as long as people get tested and diagnosed and treated. There's no reason that people's immune system would decrease like it used to in the past.
It's still a little bit surprising to people who were around decades ago when this was new and the level of panic was very high, that people can live a normal life. Can you live a normal lifespan with HIV?
Absolutely. People can live a nearly normal lifespan as long as they get on treatment. So as I said, there's no reason anyone should progress to AIDS, but we see it happen if people don't get diagnosed early enough in their disease, or if people don't stay on treatment.
Let me remind our viewers, if you have a question about HIV and AIDS, give us a call. We'll have the number on the screen, or email your question to livequestions@mpt.org. Any sense of how many undiagnosed people are walking around?
The number is probably about 10%. Of all infections, about 10% are probably undiagnosed. In Baltimore, the biggest group actually with undiagnosed infections is kind of surprising. It's youth. So people aged 13 to 24 are the most likely to have HIV and not know it.
So what you're saying is huge advantage to being tested, getting on the right medications, reluctance to do it. Maybe it costs money. Maybe you don't want to know that you have a disease that you still perceive as being terminal.
So we encourage every single person to get tested as part of their routine health care. There's free HIV testing throughout the city at multiple sites, and any doctor's office can do it. If people do have HIV, it's easy to get in treatment. If people don't have the money to do it, there's state grants that will cover treatment, there's grants that will cover medication. So essentially there's no reason financially that anyone should not go ahead and get tested and treated.
Should it be automatic? I mean, should it be when somebody gets some routine lab work that it's just automatically done?
Absolutely. So we've set up programs like that at University of Maryland, so people coming in through the emergency room, people getting admitted to the hospital. We encourage every single person to get tested, and the easy way.
But they have to agree to it. You're not just running the test.
Yeah, and the easy way to get everyone tested is just to kind of explain some of these things, that it should be part of the routine health care. We know that when doctors try to select people that they think have HIV, they don't do a good job because anyone can have HIV.
You mentioned you're treating somebody who was diagnosed in his 80s?
Yeah. One of my patients a few years ago was diagnosed in his mid-80s. And if you looked back, you could see that he had all the signs of advancing HIV disease, probably for a decade, and no one thought to check an HIV test because people often don't think about it in older people, but it definitely happens. I mean, half of the patients at the clinic that I work at and run are over 50.
You just wonder, and it's a public health question, not for you, but if everybody was tested, a lot of people would know and wouldn't go on spreading it and so forth. Let's take a phone call. Anne Arundel County, this is George. George, thanks for calling. Go ahead.
Thank you. I wonder, since the disease progresses or can progress from HIV to AIDS, is there any difference in the amount of infectious or communicability between those two stages? So would you be more likely to pass it on if you were at the AIDS stage versus the HIV?
George, great question. Thank you, sir.
That is a great question. So everyone's a little bit different in terms of how much HIV they have circulating in their blood, but as people do progress to end-stage AIDS, it is much more likely that they have a high, what we call viral load, which means a lot of circulating virus and does mean it's more communicable.
You brought a pill kit.
I did.
Very familiar. Every drugstore sells these things. Let's hold it up so everybody can see. And this one has like 2 boxes for every day of the week, right? Okay.
Right.
Why did you bring this?
I brought it to show. So if you can see in each of these, just in the morning section, there's 1 pill in here. Because there's about a dozen different treatment regimens for HIV that are 1 pill once a day. And generally people don't have side effects and tolerate them very well. And you can maybe see that it's actually a pretty small pill. So it's quite easy to take compared to the regimens of 15 years ago that were 20 or 30 pills a day.
You read about something called PrEP.
Yes.
What is that?
So PrEP is PrEP, it stands for pre-exposure prophylaxis. So that means if someone is at higher than average risk of getting HIV, they can actually take an HIV pill once a day and decrease their risk of transmission by up to 99%.
How do you feel about that?
I think it's fantastic. Baltimore is having a hard time getting enough people on it to have a major effect on transmission from a public health standpoint, because people have a lot of competing priorities, and a lot of the people that are at highest risk also have a lot of other stuff going on. So if people are struggling with housing or food or violence, preventing HIV for the long term might not be the first thing on their mind.
Is there a fear maybe that people who are on it feel invincible and might engage in high-risk behavior?
So that was one of the major concerns when it came out, and there were a lot of groups kind of speaking out against it. But the data has shown that that's not really the case. And it's a really effective treatment strategy, prevention strategy for HIV, so we strongly recommend it.
Do you know from the people you treat, and is there a way to tell how they acquired the virus? I mean, whether it was sexual activity, whether it was drug use, or whatever.
We can't tell by anything medical, but people will often tell us what their risk factor may have been. The big reasons that people can get HIV would be contact with blood, genital fluid, or breast milk from someone living with HIV. And so there's many ways that you can come into contact with it, the two biggest being sex and drug use. But what we really see in Baltimore is sex being the highest risk. But you can get it anyway. And really, anyone having sex in Baltimore, based on our numbers, is at risk for HIV.
What should people know about the behaviors are hard to change in that regard, what they can do to protect themselves, protect their partners.
So the main things we think about with prevention are getting everyone tested so that we know, medication-based prevention strategies like PrEP, and there's something we call treatment as prevention, which means that if someone does have HIV, if they get on treatment and it's effective, they can't pass it on to their partners. So we call that treatment for the partner, or for the patient, prevention for the partner. And then the last thing, as you said, is behavioral strategies.
Maybe there's somebody watching who realizes that they ought to get tested, maybe doesn't want to talk to their primary care doctor for whatever reason. Where do they go?
There are loads of different free testing facilities throughout the city. I work at University of Maryland, and we have at the Midtown campus the Community Health Education Center that does testing, and also the JOCS Initiative, which we partner with, and they do testing at their Journey Center.
Very good. Dr. Sarah Smallsley, University of Maryland School of Medicine. Doctor, thanks very much.
Yeah, thank you.
Appreciate it. Thursday at this time on Your Money in Business, tips for writing the perfect email for any occasion, plus a new grocery store expanding in Maryland. Join us for that Thursday at 7 on MPT. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.